I'm very intrigued that how you guys are communicating. Is it a face-to-face meeting, or you have created some WhatsApp group or something of that sort? How you guys are communicating?
Everyone has got WhatsApp group these days. So WhatsApp is the best, and WhatsApp is a place to chat, fight, and make friends.
Okay.
So WhatsApp group is a major way of communication. But if you have to put things in a very formal way and in writing, and for everyone to
So you are
understand and
mainly,
agree,
yeah.
you put that in email.
But in India, what we are also facing is that too much of information, as well as some contradicting informations, as well as rumors over WhatsApp itself. So how you guys are tackling that?
True. No, for example, and I know my colleagues as well. I don't, I by rule, I don't read. I might read, but I don't really rely on any WhatsApp delivered fact or misfact. To be more clear,
And maybe
you have to go back to the origin. For example, the picture of the dihydroxychloroquine azithromycin trial is doing the rounds across WhatsApp messages. And then if you actually read the paper, if you find there are so many weaknesses in that study, the French study, and therefore before we implement that, we had to read that ourselves. I read it quite closely. I got one of my colleagues read that as well, and most of us now believe that that study is totally fraught with lots of weaknesses. Therefore, as of last Friday, we were thinking of implementing that in our hospital, but we have taken a step back, looking at the weaknesses. So WhatsApp messages, absolutely not. You have to go to the root cause. There is a very good resource, Lit COVID, which is from PubMed. There, putting all the papers together. The NEJM is there, Lancet is there, BMJ is there.
I think,
But also
I think to be a responsible citizen,
yeah,
doctor itself, what we can do is that refrain from giving away messages every time and now. We need to
yeah,
know when to stop and when to keep our mouth shut. Second is, unless that is from a very verified source, like just you mentioned, right, reliable and dependable, your validated source, we should not forward certain messages. Right? Maybe I'm reading it. It's
absolutely.
whether I accept it or not. But very infrequently we forward messages and be a responsible doctor as well as a responsible citizen, right? I'm also
True.
intrigued is that now you are overwhelmed with the COVID. You are expecting the situation will go worse in coming 2 weeks. You just said that you are preparing yourself to have 20-30 ventilated patients and like that, right? But what about the other patients in the hospital? Have NHS decided not to do elective surgeries or to avoid hospitalization of not so urgent situations? So what is the take of NHS on that?
So we're talking about the uh, planning of the hospitals. All elective surgeries are stopped in most places to free up theater areas. Number one, to get the staff out of theaters to make them available to the critical care team. Number two is to be able to use the critical care theater spaces as critical care beds. Recoveries will be made into, or already are made into, theaters. And theater and anesthetic room often have uh, one ventilator each in each place. So one theater might have two ventilators. So you can make two patients stay there. So if you have, for example, 12 theater, you can make 24 beds out of them. And recoveries can take up to 8, 9, 10 patients. And one must remember that sometimes recovery areas don't have enough oxygen or air supply, and some recovery areas may not have air supply. So if you plan for uh, putting ventilators there, that might be an issue in some places. So those contingency plannings are being made, and oxygen supply, air supply is a major issue in planning all this. You must make sure that that has been taken care of. And that is the surgical side. What's also happening in medicine, lots of clinics are being cancelled, so that the medicine consultants, medical registrars, they're being freed up
But
to help out if whenever they need to, and also to free up lots of admin staff.